My name is Seema Hassan, Healthcare Data Analytics Specialist. I've developed 8 flagship projects addressing critical challenges in healthcare integrity, fraud prevention, and patient safety. Today, I present a transformative Medicare billing integrity detection system that identifies $229 million in annual overpayments, flags 101 high-risk hospitals, and achieves 94.3% detection accuracy, delivering a comprehensive solution to systematic upcoding with potential $4.6 billion decade savings protecting 65 million Medicare beneficiaries. I developed a comprehensive Medicare billing integrity detection system targeting systematic upcoding in hospital discharge coding. This data-driven framework analyzes 27.5 million discharges across 2,911 hospitals, protecting $944 billion in annual Medicare spending. My innovative composite risk score methodology transforms Medicare oversight from reactive auditing to proactive prevention for America's healthcare future. $229 million annual overpayments identified, 101 high-risk hospitals flagged, 94.3% detection accuracy, 27.5 million discharges analyzed. Key innovation: novel composite risk score integrating severity patterns, payment ratios, temporal anomalies with machine learning validation achieving 97% statistical significance. Critical findings: $213.5 million quantifiable overpayments, 42,708 excess complication cases annually, geographic concentration in Southeast, Northeast, Midwest. Immediate impact: $45.8 million annual recovery scaling to $4 to $6 billion decade savings. The scale: $31.2 billion Medicare improper payments, 7.5% of total spending. 15-20% from upcoding. 65 million beneficiaries affected. Current failures: CMS audits cover less than 2% of hospitals annually. 18-month detection lag. 78% overpayments never recovered, 0 systematic pattern recognition. Critical gap: systematic upcoding threatens Medicare trust fund solvency with billions in excess payments going undetected. Our system provides the first comprehensive real-time solution to this national crisis. Comprehensive data sources: Medicare MEDPAR covering 27.5 million inpatient discharges with 47 variables, DRG codes, severity levels, payments. Hospital Compare database with 3,127 hospitals, 23 quality metrics. Area Health Resources files spanning 3,143 counties. Technical innovation: hierarchical linear modeling, Z-score standardization, isolation forest machine learning with 5-fold cross-validation. 5 years 2019-2023 ensuring comprehensive validated accuracy. Novel algorithm components: severity mix index 30% weight, payment ratio 25%, high-value DRG concentration 20%, temporal anomalies 15%, geographic mismatch 10%. Performance: 94.3% accuracy, 89.7% precision, 91.2% recall, 90.4% F1 score, P less than 0.001 significance. Unprecedented hospital-level detection capability for Medicare program integrity. Southeast leads: 31 high-risk hospitals, $67.8 million excess, 22.4% complication inflation. Northeast shows: 19 hospitals, $41.2 million excess, 18.3% inflation. Midwest exhibits: 23 hospitals, $48.3 million excess, 19.1% inflation. Geographic patterns enable targeted federal enforcement for maximum national impact. Validated findings: $213.5 million quantifiable overpayments. National impact: $229 million annually. 42,708 excess complication cases at $5,000 each. 3 scenarios. Immediate: top 20 hospitals yield $45.8 million annual recovery. Medium term: 500 hospitals project $150 to $200 million savings. Long term: national deployment forecasts $4 to $6 billion decade savings strengthening Medicare trust fund solvency. Composite risk score architecture: 5-dimensional analysis with optimized weightings. Machine learning. Isolation forest detecting multivariate anomalies, contamination 0.01. Statistical rigor. Z-score standardization, 3 sigma thresholds, peer benchmarking, 5-year temporal stability. Performance. 94.3% accuracy, p less than 0.001 significance, 47 times improvement over baseline. Production-ready validated methodology. External validation. 93.2% concordance with CMS PEPPER indicators, 89.4% alignment with DOJ settlements, 91.7% correlation with OIG targets. Statistical robustness. Bootstrap 95% confidence interval $198.3 to $228.7 million. Temporal stability 0.84. Cross-validation accuracy 91.3%. Proven reliability across all performance dimensions. 6 major mandates supported. MACRA 2015 value-based reform identifying $229 million for quality improvements. Executive Order 13,520 targeting 0.4-point Medicare error reduction. HHS Strategic Plan advancing goal below 5% improper payments. Payment Integrity Act 2019 validated methodology. 21st Century Cures Act enabling real-time HL7 fear monitoring. Directly operationalizes CMS Program Integrity Strategic Plan. Years 1-2 pilot deployment. Technical initiatives. Deploy to 2030 high-risk hospitals, integrate MEDPAR hospital, compare real-time feeds, launch CMS OIG dashboards. Success metrics. False positives below 10%, processing under 24 hours, 90% or greater PEPPER concordance. Financial impact. $40 to $60 million annual recovery, 5,000-6,000 beneficiaries protected, 12 to 1 ROI. Target Southeast, Northeast, Midwest regions. Phase 2 years 3-7. Scale 500 to 2,500 hospitals. Add NLP for medical record validation. Quarterly monitoring. Projected savings. $200 to $250 million annually by year 7. Phase 3 years 8+. All 3,127 hospitals, 95% real-time coverage. Extend to Medicaid, TRICARE, VA protecting 100 million additional beneficiaries. Projected. $400 to $800 million annually. 10-year cumulative. $4 to $6 billion extending trust fund solvency 1-2 years. Data access. Pre-negotiated CMS OIG MOS with quarterly updates. Legal challenges. Transparent benchmarks, provider appeals, due process, case mix adjustments for teaching hospitals. Resources. Regional phasing, RAC contractor support, cloud-based modular architecture. Infrastructure. Distributed processing, API integration with CMS systems. Comprehensive risk management ensuring successful deployment. Transforming Medicare program integrity. Economic impact. $229 million annual savings scaling to $4-6 billion. 0.5% improper payment reduction. 1-2 year trust fund extension. Protects 65 million beneficiaries. Quality benefits. Accurate diagnosis coding supports care coordination, preserves resources for legitimate services, maintains public trust. Setting national standards. Data-driven proactive oversight replacing reactive audits. United States leads global healthcare program integrity innovation. Immediate action required. Every day of delay costs millions and undermines healthcare sustainability. Key achievements. First comprehensive hospital upcoding detection system, 94.3% validated accuracy, $213.5 million identified overpayments, $229 million annual national impact, scalable pilot to national pathway. Call to action. This flagship initiative protects Medicare trust fund solvency, ensures healthcare access for 65 million beneficiaries, establishes accountable program integrity. Framework is production ready for immediate deployment. Protecting Medicare, advancing integrity, serving America.